Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide COVID video number 147, which is the 65th weekly update for data accurate through August 12th, 2021. With students coming back to campus, I want to pose a question two different ways. One, how can I protect myself from COVID as I get ready to go back to school? And for the rest of the folks who are watching these videos, it might more simply be seen as how can I protect myself from the Delta variant? And then I'll quickly address how's the pandemic progressing. In terms of the things you need to do to protect yourself against the Delta variant, really nothing has changed over the past year with one exception. There is one tool that we can talk about now that we didn't have before, and that is to get vaccinated. Overwhelmingly, the single smartest thing you can do to protect yourself and your loved ones from the Delta variant is to get vaccinated. Why? Well, of course, it saves lives. I showed you last week, if you compare the percent vaccination rate compared to the number of deaths just in the past week, you can see that on the left-hand side of how many people have been vaccinated. So states with higher vaccination rates are up here, lower vaccination rates are down here, high death rates are over here. And what you can see is a very strong relationship. And there's the state of Tennessee with a relatively low vaccination rate. And you can see a fairly strong relationship. The more vaccinations there are, the lower the death rate. And in fact, of the 20 states with over half the population vaccinated, only one had a death rate of over 0.1 per 100,000. Of the 30 states with less than that, 14, almost half, had a death rate that high. And then of those states with under 40%, almost 3/4 had a death rate. So you see this very, very, very strong relationship between getting vaccinated and not dying, which is a pretty good goal to have. Second, it not just does it prevent you from dying, it also prevents you from getting serious COVID disease. There have been a number of articles published this past week. This one from the MMWR, from the CDC. Full vaccinations are effective, 96% effective at preventing hospitalizations in 65 to 74-year-olds. There was an article in the New England Journal of Medicine looking at the effectiveness of vaccines in adolescents. And though the numbers are very small, they noted no cases of COVID-19 after the second injection. So in other words, effectiveness in adolescents. And then in terms of the Delta variant, another article in the New England Journal of Medicine reported that the effectiveness against the Delta variant was pretty much the same as it was against the Alpha variant after 2 doses. So again, good evidence that the vaccinations reduce death rate, reduce serious disease. And if you want to be very simplistic about it, it can help you prevent you from getting quarantined. If you're exposed to a known case, and you probably will be, and you haven't been vaccinated, you'll need to quarantine. For students, that may mean missing class, missing work, missing social events. Right now, the CDC says if you've been vaccinated and you're exposed, you need to get tested 3 to 5 days after exposure and wear a mask for 14 days. But since you're going to wear a mask anyway, it's really no big difference. So what you don't want to do is have to get quarantined because you haven't been vaccinated. So the number one piece of advice is to get vaccinated. The second piece of advice is to wear masks indoors, except when you're alone in your office or in your dormitory room. I tend to feel fairly comfortable if I'm one-on-one, at least 6 feet away from someone. I feel comfortable taking my mask off if both of us assess that we have been vaccinated. But masking is not controversial any more than it was a year ago. We did a complete report on masks in June of 2020, over a year ago, and the data remain exactly the same. Masks have been shown to be effective when reducing respiratory shedding. They're most effective when both people are wearing it. And in fact, they're most effective when everyone wears masks. And while some masks are better than others, most masks fail because they're not worn. Some of you may remember this diagram. If the person who's infected does not wear a mask, they're spreading a lot of virus. If they wear a mask, they're still spreading a little bit, but not as much. And if you social distance and wear a mask, it reduces it even more. And this article concluded that wearing face masks protect people, both healthcare workers and the general public, against infection. And so while it keeps coming around and we keep talking about it, the data remain unchanged, that wearing masks makes sense when there's a high rate of spread. And this is what the CDC is recommending, and the American Academy of Pediatrics as well. Third piece is avoid large crowds. This is a little bit more difficult because there's no clear definition of what a large crowd is. I try to avoid being around people for any length of time unless I know who they are and we can discuss our vaccination status, or unless people are wearing masks. So generally speaking, I avoid large crowds. If you know you're going to be in a large group, say a family reunion or something, have everyone get tested beforehand. That adds an element of safety that isn't there otherwise. Obviously, if you have symptoms, don't go to work or school and stay apart from others. Contact your healthcare advisor and consider getting tested. That's not new either. But another piece of information I think is important is seek the truth. There's so much information going around right now about COVID, right? Talk shows, elected officials, faith leaders, your friends and family, they're all good people. They all mean well, but there's so much information. It's hard to tease apart what really matters and what doesn't. So I have a pretty simple principle. And my principle is this: if my car has a problem, I'm going to take it to a mechanic that I trust. If my water pump has a problem, I'm going to take it to a plumber, have a plumber come take a look at it, someone that I trust. If I have a health issue, I'm going to talk to my healthcare provider. And if I have a question about a pandemic or an epidemic, I'm going to listen to the Centers for Disease Control and Prevention. Someone recently said, well, the CDC is a political organization. Well, it's not at all. It's an organization of highly trained professionals, 10,000 of them, who are committed to keeping us safe. If I want to know information about drug development, I'll listen to the Food and Drug Administration. Again, 10,000 professionals. It's not a political organization. When you want expertise, you go to the experts. And after you seek the truth, and then speak the truth, and I say this especially for my students, you are expected as public health professionals to speak the truth. I would say, please speak it with humility and understand that it is important for you to speak up and to talk about the importance of vaccinations and masks and social distancing and so on. But it's also to do it with humility, because we know that if we simply nag people or harass them or harangue them, nothing's going to get accomplished. I think this cartoon is really helpful. Deeply held beliefs, 3 different types. And so we have to be careful. If we just continually harangue people, we may well get the opposite result of what we want. And finally, the last piece of advice I'd give anyone is be willing to change your mind as new information appears. What we will know in 2 weeks isn't the same as what we know today. If we truly seek the truth, we will hear different things. And incidentally, about seeking the truths, people say, well, what about this doctor from Indiana who said this? Or what about this researcher from British Columbia who said that? When I see those videos, I try to listen to them if I can, unless the person seems to be totally disengaged from reality. And I ask myself, where does this person differ from the mainstream recommendations? And do they provide a rational basis for why they disagree? And what you will often find is that rational basis isn't there. They say, well, these reports show, but when you look at the reports, they don't show what they purport. But seek the truth, be willing to listen to anyone, but at the end of the day, listen to the experts. And if new information appears, be willing to change your mind. In terms of the pandemic, it's continuing to grow, 4.3 million deaths, 1.6% increase worldwide in the past week. This is a little bit higher than it has been. It's been running about 1.5% to 2% week-to-week increase for several months now. 68,000 deaths in the past week and 6.5 deaths every minute. So again, don't believe anyone who tells you that this isn't a serious pandemic. And what you can see is a sawtooth pattern. In the last couple of weeks, we've had this increase again. Now, pretty much almost as many cases as at any time since the winter time globally. In terms of deaths, not quite as many as the winter time, but still more than we saw most of last summer. If you look at the United States, we see the same pattern. We're seeing pretty significant upswing in new cases. Again, the most new cases we've had on a daily basis since the November through February peak. We look at hospitalizations, the same thing. Fortunately, we're not seeing the same level of deaths. We have 635,000 deaths, 0.6 week-to-week increase, but on a daily basis, about where it was in the lowest parts of the summer. So we'll keep our fingers crossed and hope that this very sharp increase in cases and very sharp increase in hospitalizations won't result in additional deaths. That 0.6% week-to-week increase is quite a bit higher than we were seeing, about double what we were seeing, and the highest percent we've seen since late May. Almost 4,000 deaths in the United States last week. That's over 550 deaths per day and about one death every 3 minutes. So again, please understand that this is a serious pandemic and it has not yet gone away. In terms of Tennessee, we're seeing the same pattern of increased number of cases, increased number of hospitalizations, and a slowly increasing number of deaths. We just hope it's not going to increase the way it has in the rest of the world. 12,800 deaths so far in Tennessee, almost a 1% increase in the past week. In terms of ballot health, our region, 160 patients in the hospital now. That's the most we've had since late January. We're hoping that this spike won't continue to grow, but only time will tell for sure. There's a great deal more information about COVID-19 on the College of Public Health website. If you're sharing this email with anyone, please let us know. Jan Stork would be happy to add you to the mailing list. We've added several dozen people in the past few weeks. I'd like to thank Dara Young for editing, producing, and posting this video. And as always, if you have any questions or would like any information about COVID-19, please let me know. I look forward to hearing from you.